My name is Tom Scodellaro, and it's my privilege to present this audit on behalf of our group entitled The New Normal CPET Findings in Patients Aged 80 Years and Older. I'd like to start by posing a question. What is the most appropriate way to interpret CPET findings in older patients? Patients in which making an accurate and nuanced assessment of perioperative risk may be particularly important in shared decision making. One could apply the current POETS guidelines for assessment of perioperative risk. This is perhaps a blunt measure in what could be complex patients. Paul Alder contended that anaerobic threshold was the best measure, though his studies included a minority of patients aged over 80. It's possible to interpret results against one of several predictive algorithms for metabolic function, but these two are based on young, healthy populations. An alternative we propose would be to use population data to define normal results for an older patient group, which can then be used to provide context for further interpretation. We therefore set out to characterise normal CPET findings in our patient population aged 80 years and older. In doing so, we compared these results to existing risk thresholds and predictive algorithms used to quantify perioperative risk. We undertook a retrospective audit of CPET results between 2012 and 2025. Of the over 4,800 tests, around 16.5% were in patients aged 80 years and older. After excluding tests with missing data or inadequate testing, 677 CPET results underwent analysis. The median age was 83.3 years, and the maximum age was 95 years. Not surprisingly, the mean anaerobic threshold and peak VO2 observed were lower than might be expected in the general population, especially amongst women. For this reason, 35% of patients would have been categorized as having an elevated perioperative risk using current criteria of an anaerobic threshold less than 10 and a peak VO2 of less than 15 milliliters per kilogram per minute. We also observed considerable variation in results. For anaerobic threshold, the standard deviation was more than 2 milliliters per kilogram per minute in both men and women. This perhaps reflects heterogeneity in terms of comorbidities, pathology, and frailty within this older patient group. Overall, the predictive algorithms assessed were very poor at predicting peak VO2 when compared to the observed results. Only one model, Jones 2, when applied to women, was not statistically significant when compared to our observed data. Indeed, using some algorithms in older and shorter patients, it is possible to predict a peak VO2 less than 0. Admittedly, this audit is not without its limitations. The retrospective use of a large dataset makes it difficult to control for confounding factors. The data presented is not associated with perioperative outcomes. Nonetheless, we have created a framework that helps define normal CPET findings specific to our older patient cohort. We have demonstrated that a large number of these patients are high risk using existing criteria, and predictive algorithms correlate poorly in this older group. Whilst there is more work to be done, we have laid the groundwork for a more nuanced assessment of CPET findings by comparing patients' results against their age-matched peers. Thank you.